So good noon, everyone. To those who are joining from South Africa and the CET time zone, and good afternoon to those who are joining from the East, and good morning to those all who are joining from the West. So I am Professor Babu Paul, the Director of the Institute for Intelligent Systems, one of the flagship institutes in the University of Johannesburg, which works towards driving 4IR initiatives and discussions. So on behalf of the Institute for Intelligent Systems, Faculty of Health Sciences, Department of Strategic Communications, and UJ Library, I welcome all of you to this talk. This talk is being recorded and also being streamed live on Facebook. My greetings to all those who are joining us on Facebook. So that today's talk will be, the title of the talk, it is the second in the series of our talks on fake news and related things. The title of the talk is A Tsunami of Disinformation Around the COVID-19 Vaccine, because all of us know that the COVID-19 vaccine is being delivered and given all around the world, and there is a lot of disinformation going on. So it is quite timely, this talk. Along with this, why this disinformation? Just to give a brief, because we have seen a lot of advancement in technologies over the past couple of decades. But with the advancement of technologies, it is not only the advantages that came with the technologies, there were disadvantages also that came in. For example, we came to get new words like climate change. We came to get new words like ethical issues while handling data. Mental health is becoming a very big thing. Fake news is another very big thing. So that is why it is quite timely that in the fourth industrial revolution, fake news is becoming very, very prominent, and it needs to be addressed by different stakeholders. So today our guest speaker, I won't say the guest him as a guest because he is part of the University of Johannesburg also. So today our main speaker is Professor Ramneek Ahluwalia. So it is an honor to introduce him, and I would like to thank Professor Ahluwalia for taking time, because it is a very busy time during this time, the work he does. So Professor Ahluwalia is the Chief Executive Officer at Higher Health of South Africa. So Higher Health is basically a national agency that works with more than 2 million students across 26 universities and 50 TVET colleges in improving the health and well-being of the students. So Dr. Ahluwalia is a qualified physician and a health systems policy and management specialist. He has many qualifications in his bag. So some of the qualifications are he has done his MBBS, MBA, a gold medalist from University of Cape Town, a PhD in public health. Professor Ahluwalia, as I was already saying, that he is not a guest. So Professor Ahluwalia is a professor of practice at our Faculty of Health Science in University of Johannesburg. He has authored several national and international publications in public health, HIV, mental health, and allied areas. He serves on various boards of the government and non-government organization. He also served as an health expert on the BRICS Academic Forum. So I think Professor Ahluwalia is the right person to take us and steer us through this tsunami of disinformation and steer the boat to safety. And we also have Professor Rifilwe as the discussant to today's talk, and Professor Mandla Kadebe as the respondent to today's talk, and Dr. Hyman Myberg. Herman will be today's facilitator. So with this short note, I hand over to Dr. Herman to take it forward. Over to you, Dr. Herman.
Thank you, Prof. And I could not agree any more with you that Professor Ramneek is one of the best individuals in South Africa to discuss this topic with us. And since our last discussion on the topic, we have received many questions and comments and links to various online articles and discussion boards. And there was even one case of a chain SMS propagating fake news surrounding the vaccine and different aspects of the COVID-19 pandemic. And I honestly did not know that chain SMS is still a thing, but apparently it is. In a world where fake news and misinformation is so rife, we need an arsenal to fight back. And I believe the best way of fighting back is to use logic and facts. So who better to help guide us with the right logic and the right facts than our panel of individuals today. We welcome you. Thank you so much for joining us. For those of you that don't know, especially us here in Gauteng, tsunamis are very long, high sea waves caused by some sort of disturbance. In our case, COVID-19 and the uncertainty that comes along with a pandemic cause disturbances in our daily lives. And we are now seeing the ripple effects. People are starting to question the false sense of safety that they had before the pandemic. And now often we find ourselves questioning everything. The fact that a vaccine was developed within a year of the outbreak is a laudable achievement. But it is that achievement in itself that has caused distrust, since vaccines usually took many years to be developed, and now all of a sudden we have a vaccine within a year. However, this is what makes it great for me to be a scientist in the fourth industrial era, where we have many technological advancements that have resulted in science becoming more agile, becoming quicker to respond to real-world problems. And what better way to respond quickly than in the present? And giving us his response, I now welcome Prof. Ahluwalia to the stage. Thank you so much for your presentation. Prof, the stage is all yours.
Herman and Prof. Babu, this is an absolute honor, and thank you very much. I'd like to share a presentation. Greetings to yourself and Prof. Babu, to everyone who's listening. To Prof. Rafilwe, to Prof. Mandla, and everyone who is part of this discussion. It's an absolute important topic. So with your permission, Chair, what I will do is, I'll talk about the infodemic. In fact, it was early April where we actually knew this is going to be one of our biggest battle to fight along with a pandemic like COVID. So if with your permission, what I'll do from my slides is also put up a case study of higher health work, that how did we fight infodemic, and what did we do to fight this, considering we knew this might be a massive challenge, considering a sector of universities and colleges where we've got a lot of learned youth around us, and the technology that makes infodemic quite possible in our sector. So that will be my presentation around. So 5th of March, we all knew that South Africa confirmed its first case of coronavirus, and the South African government took some quick and decisive action to combat the spread of the disease. But there was another killer that started growing under this whole COVID pandemic. And that was misinformation and disinformation about COVID-19. So predominantly, we are fighting two pandemics in the same pandemic. So one pandemic is the spread of the virus, and how do we capacitate our health systems? That's where the whole energy is going, with the anticipated influx of cases, it fills the whole health system, collapses the health system. And then there's an economy to be saved because the lockdowns prevent many sectors to collapse. And then it's our own academic year to be saved, skills development programs to be protected. The whole country is fighting this pandemic in this ground. And then there's another pandemic that's moving paddle that kills everything. And that's the spread of the fake news, the myth mongering, which in turn results in stigma, additional and unprecedented far bigger challenge that it comes to us. So I sincerely would like to thank the University of Johannesburg for this opportunity, though, to speak on this pertinent topic that has plagued our country and probably the whole world. And it's not a new problem. In fact, if you look at other pandemics, and I'll give you some of the case examples of when we were fighting HIV, or how stigma and how fake information or myths actually brought us so delayed in our ARV responses, in our pandemics fight. And this is not something new for COVID. It is something that has been in the system, it's existent. And I think now we are, from those lessons learning, that the big thing that we have found is the vaccine, which we know is one of our biggest arsenal, if not the complete arsenal, the biggest arsenal to eradicate this virus out of our system, will face the same kind of myth-mongering of fake information that will lead to a lot of vaccine wastage and a lot of people not opting and killing the whole efforts of eradicating this virus. So it's very timely on this issue. It's a very important topic, which is onto the mandate of higher health. And as the Health and Wellness Agency of about 2.5 million South Africans, it is predominantly one of our biggest efforts to run these two pandemics in the same time while we have the same pandemic. Apart from the malicious and deliberate efforts to cause confusion by screening individuals at an incredible critical time, I think we can agree that COVID infodemic can be attributed to the fear of the unknown and panic which has gripped the world and the human need for certainty. And I think the unknown fear produces all these kinds of myths that come along with it. The stigma and other possible dangers posed to our society by the pandemic of misinformation and disinformation has been of great concern to us. And of course, the entire youth and the post-school system from the outbreak. Now, we all know we've just withered a second wave, and we might be sitting on the first part of the third wave. We're seeing cluster outbreaks in some of our universities around our country. The orientation months, the first years are coming in. There are unspoken super spreader events happening, some parties happening. And, the rollout of vaccine is kind of, as the president has yesterday kind of declared the phase 2 from May onwards and how the whole rollout is going to happen. I think it's very, very pertinent that we discuss this in clarity. And I think, there has been misinformation. Let me talk about some misinformation from the beginning of the year when we started the whole COVID pandemic. In certain countries, rumors about impeding food scarcity, it happened in South Africa too, made people run and stockpiled. If you remember those months in March and April, the fear of the unknown and people were running into the whole, those were empty. That's something that came from these kind of misinformations about this pandemic. In the United States, a person passed away from ingesting a whole fish tank cleaning product containing chloroquine, because that time there was a kind of a claim that chloroquine is a possible treatment of COVID-19, which was still being investigated and still to be proven. In Iran, hundreds of people died drinking methanol because alcohol through social media was considered to be a disinfectant, and people started considering this. And there are many more in this list, these kind of dangerous misinformation that we the pandemic into difficult times. So, a Facebook study which was done on vaccination use of about 100 million people and what their views are. From the COVID perspective, the pro-vaccination camp, about 6.9 million people clearly outnumbered the people who were against it. But if you look at the anti-vaccine people, it all required was only 12, they identified 12 individuals who were predominantly the biggest against the biggest anti-vaccine drive. And they had the largest group of following of 74.1. So what it clearly shows that any misinformation or negative information or something which is social media savvy attracts more people than people who are trying to put some authentic information and together in that regard. Now, Africa and various parts of the world have battled in various epidemics such as Ebola, swine flu in the recent past. But I mean, we can't compare them to what coronavirus has done. But history has told us that we've been fighting HIV as a pandemic. We are fighting TB. We are fighting unplanned pregnancies. And we're fighting mental health. We're fighting many other pandemics that are existent around it. And there has been misinformation, and South Africa and the world grappled with it, but still continued fighting. And there are many lessons to be learned from that engagement of misinformation. The other thing is that social media is definitely one of the biggest breeding grounds of misinformation around the country. So a case in a point is, can a youth-focused approach help us flatten the curve by creating awareness and promoting education, both on social media and out of social media? And I'll explain why. Of course, we are a country with the highest youth population in the world. One of our biggest population is youth, which is between 18 to 34, which is about 1/3 of our whole population, which means youth will play a very central figure. Youth are the ones. It's not like we just saying youth is the kind of people spreading the misinformation, but they are one of the component that is forwarding the misinformation, created or generated from the sources that they come. But they are one of the super spreaders of facilitating the spread among each other and following through the way it has come from that perspective. And that's why youth will be a very important figure in my discussion of how do we tackle such misinformations and myths moving around. So if we have to tackle this pandemic, so I'm going to go straight into what I feel we should be discussing in this. We can talk about what infodemic can actually cause, and I think we all agree it's a massive problem and it can change the whole outlook of our thinking. But then I want to discuss through my presentation, what can we do to fight misinformation? What are the tools? What are the arsenals we have? What we have deployed? What are the good practices we have seen where we can fight misinformation? That is what we need at this moment to put against building a system against this anti-vaccine misinformation drive that's going to happen. So social media, as I said, is the biggest breeding ground of misinformation, fake news, and youth are inclined to find expression in the cyberspace. So therefore, can we galvanize young South Africans into an army of mythbusters and being change agents? So, but nothing better than higher health to give you an example, that the only way we fought pandemics like HIV or the pandemics like gender-based violence we are still fighting is through the army of educated young South Africans in communities. So just imagine 10 young girls talking about contraception. About 5 years back, we wanted to drive a whole contraceptive program in rural communities. We went to Ladysmith and we wanted to drive this long-term implant. Lots of myths around it. People thought you're injecting the subdermal implants that can cause absolute harm to human life, or these can even cause HIV. And there were many rumors and myths moving around it. So we picked 10 young girls in a rural town of Ladysmith. We capacitated them completely on the use of the subdermal implant so that they can go to schools, into TVET colleges, into universities in around that area, not universities, but TVET colleges, CET colleges and schools around that area, and promote to avoid teenage pregnancies, to fight teenage pregnancies or unplanned pregnancies. And we could get 250 girls in 1 week to ask for the subdermal implant, because the power of an educated young South African sitting with the community headmen, speaking the language of the Zulu changes when you go from Durban to Ladysmith, and asking the community to take charge helps us fight myths much faster if we can. And that is something we have done, and we'd be doing it against COVID, and we have to look at that space from the anti-vaccine perspective. Do this where they feel comfortable, and the so-called problematic spaces is social media. Of course, it's undoubtedly the biggest area of us. Technology will play a massive role. I'm going to give you an example of technology. where social media will play a massive role. And then, of course, not everyone has access to social media. Other things like radio and peer-to-peer education program helps. So higher health model. So higher health has historically have 10,000 peer educators all around the country. So I gave you an example of the 10 girls. Similarly, we've got everywhere. Now, we need to build them against the anti-vaccine. That's what higher health program is going to be. Build them on full understanding of COVID vaccine, why the vaccine, avoid any misinformation so that authentic peer-to-peer information moves from one flow to the other. We think it's a great process of fighting this. Higher health push the process of continuous education. So frontline workers, if they have to fight defoggings and wrong scientific information of cleaning, or what is this deep cleaning, the best is to train and capacitate and continuous. When we build 30,000 frontline workers on scientific information and continuous training, even this year, information goes properly and we fight misinformation. Capacitation of student and union leadership. You can't have them, you can't win without leadership, and you need to build them as brand ambassadors. That's what higher health does well. Media briefings, minister does excellently well, speaks to the parents, guardians, use local media, and of course our radio program approach. Higher health study shows 83% of our students listen to campus radios and community radios. So if we build 200 radio journalists, 21 radio stations, streamline continuously authentic information. So we kind of parallelly running against the anti-vaccine prop as being a followers to people to say, come and follow us in that regard. We had no choice we had to use fourth industrial revolution. And I want to give you an example. When the minister and we sat together in late March, we had 2,000 campuses. University of Johannesburg, WITS, UCT, these are strong institutions, can do remote learning. But how do you teach plumbing, electrical, fishery, industries, engineering, remote learning, and plus in rural and areas in community where we don't have data access, devices, we had to open. We knew we had to open if we had to save an academic year. So the best cost benefit analysis, we can't be building screening stations, millions of thousands of screeners every day to screen every day. It's just not cost effectively possible. And we have to screen tens and thousands of people entering our campuses on day-to-day basis. So technology, we deployed health check, 6 months, 1.6 million students, 10.5 million daily passports. We got a channel to communicate authentic information every day on the same COVID symptoms, same COVID principles. We run on with them communicating indirectly or finding ways of scientific ways to do it. Obviously, it's a great success story in 6 months because we had ministerial launches, we vice chancellors supported, principals, unions, student leadership, a lot of work. But the biggest part was we made it data-free, WhatsApp, web, made it more youth-friendly, huge boosting on SMS campaigns, Facebook, WhatsApp. We went together, full-blown. And we got people to believe in health check. And misinformation could move away and things could happen. And maybe these are the tools. Now we're going to use this for if we have to move into vaccines, information on vaccines. We've got reach. We've got people connected to us. We need to find the will to do this. Multi-language, multi-channel, NDOH, Department of Health verified, NICD puts the contents with us. It goes through a most authentic scientific route straight to our population. Second route, continuous education. We've got 1 million students across the post-school system that comes through our informal curriculum or a formal curriculum, but more in a second curriculum and informal or extramural sessions. Now, what we've done is we've lost the last year because of lockdowns, but we now know we need to live with this virus. So face-to-face learning is started. So as much as we got digital learning, which I showed you the tool, we're going to continue face-to-face through our 1 million enrollments into proper scientific information, but continuous. And if we can do it through knowledge transfer, which is practical learning, and then linking them to service, which is our model. So let's learn, let's do, and then let's act. I think we need to deploy COVID in a very similar myth-buster information like we did for HIV and to remove stigma. And I think the tools we have learned over last 20 years to fight pandemics is now to be deployed to fight COVID. And that's exactly what we're doing through curriculum and stuff. So I didn't want to go too long, but I had a couple of last pointers to put in, and to say that I'm very happy that Facebook, Twitter have started an act against the anti-vaccine disinformation, a decision to remove false or misleading content. And this is what commitments we need from government. We need from social media platforms. They got a policy called COVID misinformation policy, and that is something we need. It is very critical that government, policymakers, program managers, scientists, medical entities, civic groups, and other colleagues through universities, through our higher education, needs to get connected. Exactly what, Babu, you're doing at the stage, and to ensure that our campaigns are very scientific and overpowering the mythbusters. So if they follow the mythbusters, we need to have our campaign so strong that they follow us. That's the only way you are fighting an enemy that you also can't see. So as much as COVID is an enemy we can't see, we are fighting the same misinformation to most of the people we can't see. We only see through forwarded stuff that moves around into our system. So I won't take more long. I'd rather be more happy to look at the discussions and stuff, but I felt rather than a problem, I look at solutions. And I've channeled most of my presentation on the solution. But thank you very much, and an absolute honor. Thank you.
Prof, thank you so much for sharing the practical aspects of what you are doing and how you are doing it. It truly is amazing to get 1.6 million unique users onto the service in a question of 6 months. If it were to be monetized, you would have been a billionaire by now. But yeah, we really thank you for the work that you are doing. And it is, I mean, the work that Higher Health is doing in addressing 2 million students of South Africa, that is the future of South Africa, and keeping them healthy, it's such an important task. So my hat is off to you. Thank you so much for that presentation. We will keep the questions and answers until we've heard from our respondent, our discussant. So our discussant for today is Prof. Phaswana-Mafuya. She has recently joined the University of Johannesburg as professor in the Faculty of Health Sciences. Prof. Phaswana is a world-renowned epidemiologist with skills in designing, executing, and analyzing rigorous HIV and chronic non-communicable disease epidemiological studies. She's an NRF-rated scientist. She was declared a science role model and science ambassador by the National Science and Technology Forum. And among her many achievements was to chair the 9th South African AIDS Conference. And she was also appointed at the Academy of Science of South Africa as a merited scientist. She's a fellow of the African Academy of Sciences, a fellow of Organization for Women in Science for the Developing World, a Wellcome Trust Fellow, and she received the Human Sciences Research Council CEO Award for a long-standing service. She's also a member of various boards and panels, including Higher Health, Board of the National Research Foundation, the Council of the Academy of Sciences of South Africa, and the International Panel on Infectiology. That is a real mouthful, but she's a very talented lady, and I've worked with her some over the years. And Prof. Phaswana, the stage is all yours.
Thank you very much, Chair, and I must also appreciate the opportunity to be part of this amazing engagement. I've worked very closely with Professor Ramneek, and I must thank him for his wonderful presentation. I serve in the board. We have seen Higher Health climbing higher heights under his leadership. And just now, the information he has really provided demonstrates the commitment of Higher Health in ensuring the provision of authentic information. And he has illustrated ways to fight misinformation. And as we have seen, Higher Health has innovations and technologies, strategies, and interventions that are in place, to fight misinformation. And that is greatly appreciated, Chairperson. I wouldn't agree with the assertion that we couldn't have had a better person to be the guest speaker for this talk today. And I must appreciate the Department of Communication for having initiated this series, because information is power and communication is a powerful tool. In fact, I want to read this quotation, which I felt it would make perfect sense in the context of the de-tsunamization of COVID-19 vaccine misinformation. Lawrence Overmine says, misinformation destroys trust. It destroys the bonds that hold society together. And in this case, we have a vaccine that we have been working very hard to have. And we are beginning to experience vaccine hesitancy and vaccine resistance or lack of confidence in vaccines because of misinformation and disinformation. That is why institutions that proactively share factual information and react to fake news are very critical. There is lack of information, obviously, that we are seeing around the benefits and associated with vaccination, as we hear about lots of myths that may affect low acceptance rates. And we know that the more we get people vaccinated, the lower the transmission rate would be, and immunity will build. Then we will have herd immunity sooner rather than later. And ahead of the third wave of COVID-19, nothing can be more important than to emphasize the importance of acceptance of vaccines. And I want to allude a little bit, in addition to what Professor Ramneek has said, to the acceptance of vaccines and why it's important that proper information is channeled and uptake is good in order to fight this pandemic. Vaccines, by nature, introduce antigens into one's body with the aim of inducing an immune response, which will become a subsequent protection through some immune memory. And when we have an intervention like a vaccine, which is a preventative measure to fight the pandemic, we really need 0% vaccine hesitancy. And the critical thing, to put on the table is the fact that vaccination does not only protect those who vaccinate, but it protects all of us, like I've just mentioned. And Dr. Ramneek made an important point about the fact that we've had vaccines in the past to deal with outbreaks, pandemics, like measles, smallpox, polio. We wouldn't have been here. It is through those medical advances, technologies, vaccines that we are here. So no vaccine can be administered without the necessary approvals. It is misinformation to hear insinuations, about the vaccines, being, having chips or being some satanic tool, to take people to into a different direction, or government assisting businesses to make money and so on. Vaccines cannot be used without necessary approvals. There are stages of vaccine development that need to be followed. There are decisions that get to be made in cases of emergency where a vaccine may be authorized as a public health measure, and our vaccines have undergone all of such. And as vaccines are administered, we continue to monitor their effects so that we can improve as they are being implemented. And it's like any other medical intervention. A vaccine have adverse effects. And the president has alluded to that in his talk. Various scientists have spoken about that. It is it's not something that should create fear, just like any other medication. You might experience pain, tenderness, redness, and whatnot, or fever, or nausea, or fatigue. But the long-term goal is to make sure that your immunity is strong enough, to fight the virus. I need to mention a few stats that concerned me. That a recent survey found that less than 64% of South Africans would accept a COVID-19 vaccine. And we need that. We need, in terms of the studies that have been conducted, for us to reach herd immunity, we should have at least 2/3 of the population vaccinated. There's still a long way to go. The Johnson & Johnson vaccine is our hope, and we are hoping that there'll be more uptake, and that misinformation does not win and does not destroy the vehicle we have on hand towards fighting the pandemic. Vaccine hesitancy, as I wrap up so that we allow the discussion to continue. Vaccine hesitancy is a very, very dangerous tool that is an antidote towards all the efforts that are being made. And I'm glad that Dr. Ramneek mentioned that this was envisioned, and hence there are strategies in place. Because it will decrease vaccine coverage, it will increase the risk of vaccine preventable diseases, it will pose a threat to our herd immunity, it will have significant risks, especially for those with comorbidities and frontline workers. It will delay communities to reach the threshold of coverage necessary for immunity, for protection, and for us to defeat the pandemic. I'll pause there. Thank you very much.
Thank you, Prof. Refilwe, for getting that together for us, and for that wonderful summary of what is going on in the world now. Next, I would like to introduce Prof. Mandla Gadebe. He is also with the University of Johannesburg, and he is a seasoned communication practitioner with experience in various sectors, including the public sector auditing, financial services, ICT, government, higher education. He's the author of Constructing Hegemony, the South African Commercial Media and the Misrepresentation of Nationalization. A true wonderful title. I'm looking forward to reading that. Prof. Mandla is the former head of communication at the Auditor General of South Africa, and has also worked for Absa Bank, where he held various positions, including heading the communication function for the retail banking sector. So if any of you ever received an Absa mail, it was his department that sent it to you, and I hope that it was positive news. He holds a PhD in media studies, a MA and a BA in journalism and media studies from WITS, as well as a BC degree in computer and information technology from Vista University. Prof. Mandla, how are you experiencing this COVID info pandemic that we are experiencing now?
Herman, Dr. Maybek, thank you very much for that wonderful introduction. And I'm certainly experiencing it as it has been articulated by Professor Ahluwalia, as well as emphasized by Professor Phaswana-Mafuya. And I think that the 4 points that Professor Ahluwalia makes are very important, and I think it's how most of us have experienced this, what Professor Ahluwalia calls another pandemic, the pandemic of disinformation and misinformation. It's a first, I think, experience. But I think the second point being raised, which I think is very important for us to take, is that social media is is the breeding ground for spreading misinformation. And the third point that I think he has raised was that the youth has become a super spreader for disinformation and misinformation. And now all these points have been emphasized by Professor Phaswana-Mafuya in the context of the practical steps that I think Professor Ahluwalia has made for us to consider some of these points in the context of misinformation and disinformation. In emphasizing these points, I just want to make three quick theses as a matter of emphasis, Program Director. And the first thesis I would like to make is that disinformation and misinformation, of course, is colloquially now known as fake news, and driven by the advancement in technology such as artificial intelligence, has certainly become a threat to our democracy. I think that's very important. And the second thesis I'd like to make is that this threat of social media to our democracy must be understood in the context of technological advancements, as I've raised in the previous point. Now, I think that the third thesis I would like to make is that the same technology should be considered as an opportunity, while it remains a threat, should be considered as an opportunity to protect and consolidate our democracy. Because, and I think this point as raised by Professor Ramneek, is that social media is a basis of many people's experiences of disinformation. And I think when it emerged some 10 years, a decade ago, if I'm not mistaken, we all perceived social media as an opportunity for our thoroughgoing democratization process for societies across the globe. And to that effect, we all saw dictators falling and on the basis or on the back of social media. Some of you will recall the events of the so-called Arab Spring. And of course, social media has played a very important role in social justice projects. Last night I was watching the live events of George Floyd killing, which was captured and spread on the basis of social media. However, as I've already indicated, is that social media within a decade, powered by the advancement of technology, it went from being a facilitator of democracy to become a serious threat to this democracy. We are all familiar, for example, with the saga that involved Facebook and the Cambridge Analytica, and quite a number of developments around social media. So today, social media is increasingly used to spread information and disinformation and potentially threatening our democracy. So that's the first point I just thought I needed to emphasize in the context of the very good practical points that have been enunciated by the two first speakers. And quickly, on the second point, so that I can pause on for further discussions, is that there's no doubt that artificial intelligence must be considered as part of the solution in dealing with the threat of disinformation, in my view, and therefore the threat to our democracies, because we all know that AI has exacerbated the problem in three fundamental ways, if I can quickly point them, Program Director. Firstly, we have seen how states can, for example, using artificial intelligence, control and supervise the movement of citizens. We've seen that in how the Chinese government collects individual data. We've seen how the police in the United States, in some states, for example, have employed technology for policing purposes. But what then has happened, we all know that in some instances, the very same technology has been used for example, to target African Americans. But also this technology has been manipulated, as I've already indicated, in threatening democracies, a point I'm not going to spend too much time on. But also, I argue that this leads to frustration to citizens. And if citizens are frustrated, that limits their participation in democracy. And the third thesis, I think, which is very important in my view, is that we should consider using this technology as a basis upon our response to deal with misinformation and disinformation. Because I am of the view that just as artificial intelligence can be used to hyper-target individuals who are spreading fake news, who are producing deep fakes, and it can be used to detect those people. We can employ artificial intelligence to drive processes such as reverse engineering and various opportunities that are there to manipulate data and therefore defend our democracies. So I think that for me, these are the 3 points that I just thought we should emphasize as a starting point, as an entry point in dealing with the situation of disinformation and misinformation. And to add to some of the practical steps that the two previous speakers have pointed out, we need to consider other platforms that are available to us, such as traditional media, to combat and counter the spread of fake news. Let me pause there, Program Director, so that we can allow space for further engagements during the Q&A session. Thank you very much.
Thank you so much for that summary, Prof. Hadebe. It is truly interesting that we find ourselves now at a time where we need to start monitoring social media, but on the other side of the weight is or of the scale is that we need to also allow freedom of speech, and I think that is something that we should discuss in a future follow-up presentation, is how do we manage that. So if I may ask all the panelists, can you open your video and audio, please? And then we can have an open discussion on some of the questions that we have received so far. Just scrolling through them. So Millie Firi wants to know, who leads anti-vaccination programs in South Africa and what methods do they use? Have we done any social listening in South Africa to find out where misinformation emanates from? And then she follows up with, in some countries, they are facing a problem of private closed Facebook groups where misinformation is shared. Do we have the same problem in South Africa, and what can be done? So from my perspective, I believe that we've got many of these closed Facebook groups, WhatsApp groups. The other day, I saw that on Signal, you can join groups based on your present location. And I went on it, and it's amazing the type of groups that you get. There's groups that's selling marijuana in an open platform, and anyone can join. So it is truly a massive problem having an open internet. But then again, we need an open internet to have freedom of speech in our country, and that's something that we fought for very hard to attain. So Prof. Mandla, I don't know, do you want to add onto that?
I think we have to be very careful in ensuring that, for example, the point I'm raising on regulation, we should be very careful that we do not begin to infringe on the importance of freedom of speech in defense of democracy. So that for me is very important. I was laughing at the point of groups openly selling marijuana. But can I quickly reflect on the question that was raised by KBC on government communication, if it's fine with you, Herman?
Yes, please. Can you just read the question as well? Yeah, how effective was government communication to dispel misinformation? Were they also caught in a not knowing bubble? If we look at stockpiling of food early on in the COVID pandemic.
Yes. So I thought it was a very important question, because in my view, from where I was sitting on the first part of the question, I thought government did very well using traditional media in driving messages. We are all impressed in the manner in which how the president was leading us at the very early stages of the pandemic with what effectively became known as the family meetings, and subsequently how the various ministries will then lead us in articulating what needed to be done going forward. However, I think one of the tricks that the government missed in driving its communication was that disinformation and misinformation largely takes place on social media. It is largely driven by technology. And on that front, on that aspect, I felt that the government was a bit found wanting. I mean, there were stories about G5 technologies causing COVID-19, and government really struggled in coming up with effective strategies of dealing with it. So I think that's just my perspective in how government so far dealt with that matter.
Yeah, I think since none of us has ever lived through a pandemic and more importantly through such a big infodemic, that we don't have all the answers yet, and we are all trying our best. Which brings me to the next question. What more can we as scientists do to fight misinformation and disinformation? It's often difficult to present scientific evidence effectively to the public. And I would like to open this question up to the whole panel for discussion, as this is a very important question to me as a scientist. How do we fight misinformation if you are talking to a granny that says her church says this is so? How do you dispel the mistrusting?
Mandla is absolutely right. Prof. Mandla is absolutely right. You know, the president did a wonderful job of communicating to the public through the traditional media perspective, and we got wanting into the social media or the tradition or the technology element where we can't locate who's spreading it and how it starts and originates. And it's a tough question in that regard. And so the question which is now asked is, and that's exactly what we need to always realize, is that we need to be faster or aggressive than the anti-group that has to go. And that is the reason when I gave my presentation, I predominantly focused on what has worked in the past or what's worked and capitalizing on it to be more aggressive from the system of technology that will challenge us. Even if it's US, South Africa, any part of the global world, this is not going to be unique to only South Africa or to higher education. It's going to be a challenge that will remain till now. Technology will govern us or move us into this area. So as human mind, we need to then capitalize technology to beat technology. You know, so the antidote of technology is technology. So the question is, how can government, how can agencies be aggressive and more forthcoming in planning and preparations and strategy development, knowing that this pandemic will come with another pandemic called infodemic. It's going to exist if for coronavirus, and we're going to exist into another pandemic very soon. It's going to go with that pandemic too. You know, so everywhere an antidote to a technology needs to be built in a more aggressive way to fight such a thing. So the examples I gave of the fourth industrial revolution, of going faster, of attracting the 1.6 million people onto our system, was predominantly that we have an access channel to them more quickly than this whole youth population that will still be filtered by their own streams of work. So what I'm trying to say is, the case study I told about KwaZulu-Natal and Ladysmith was predominantly that aggressive approach to say, okay, how can we now use our own, galvanize our own people in both advents to defeat it? So this is going to be the battle. It's not, there is no nuclear weapon that can kill infodemics in one moment. It's never going to happen. Or there's no vaccine to this. In fact, this is one area where scientists will say there's no vaccine. So all I'm trying to say is the only answer to this is aggressiveness, strategy, multi-sectoral approach. Scientists need to easy form their understanding into easy English. We need people like Mandla who can communicate scientific information the most positive and the most inclined way. We need to be fast and aggressive.
Multi-sectoral, we have HIV, the HIV pandemic to learn from. As a country, we are the epicenter of HIV, and we know the kind of infodemics that happened, and continue to happen, which we continue to fight, and we have seen how much progress we have made. Yes, stigma has not been completely eradicated, stigma and other myths and whatnot have not been completely eradicated, but through ongoing communication, multi-sectoral approach, and as Prof. Ramneek says, no single agency can fight disinformation or misinformation and win. We need everybody on board, and we need multi-level communication. And that will go into issues of communicating at the level of the people, using the language that people understand, using various methods, multi-methods. Radio station, community radio stations, Prof. Ramneek alluded to this in his presentation, and using various forms of technologies, and also thinking innovatively, and moving with the times. The fourth industrial revolution presents a lot of perplexities and challenges, but with it comes a lot of opportunities that need to be exploited. And having young people at the center, as change agents, and using these very tools towards advancing positive information or correct information is the way to go. I'm sort of repeating what Prof. Ramneek has said in my own words, but I'm saying we don't have to start afresh. We already have the momentum we have learned from past pandemics, and we can draw from that.
Excellent. And I mean, you really fought hard in the HIV infodemics. So coming from you, I do appreciate that answer. And I think there is loads of overlap between the HIV pandemic and the coronavirus pandemic. What I saw in one of my students' work that is addressing stigma is that one of the respondents indicated that their children were named COVID because one of the parents had contracted COVID-19. And that's just the way it works in South Africa, unfortunately. And that's why we've got such a massive job at hand to dispel all these stigmas that surrounds us. Unfortunately, our time has run out. It is now 1 o'clock. It was very fun. Prof. Mandla, would you like to close off for us, please? And ladies and gentlemen, thank you very much for joining in and for making the time to come and hear what our panel of experts had on their hearts. To all our panelists, thank you so much for availing yourself and for really informing us and for guiding us in riding this wave and surfing it out onto the shore. We really do appreciate it. Prof. Mandla, over to you.
Thank you very much, Dr. Maibek. I think it is important that we must thank you for facilitating this session very well, and also thank both Professor Ahluwalia and Professor Phaswana-Mafuya for very important points. And I think in my parting shots is that I agree with you, Professor Refile, that you have every right to repeat what Prof. Ramneek said, because yes, basically laying the basis of what has worked and what he is doing very well, which I really am enjoying it. So we have to learn from the past so that we can manage such difficult situations going forward. But certainly the discussion has to continue because there is so much fake news, if I can call that, on the internet. So at some point, people don't know what is truth and what is not truth. So the discussion and the discourse has to continue. Thank you very much. And thank you very much to everyone also who participated and to make this very successful. Thank you.
Thank you very much.
Absolute honor. Thank you.
The University of Johannesburg, the future reimagined.